Today we are going to discuss about the causes of male and female infertility and their treatment. Basically, the causes of male and female infertility and the causes of male infertility is there is about 14th important points of the causes of male infertility, that is testicular failure, injection of epididymis, that is seminal vesicle or prostate, then hypogonadism, cryptorchidism, congenital abnormalities, varicocele, blockages of the sperm, absence of sperm, that is known as the azoospermia, low sperm count, that is oligozoospermia, abnormal sperm morphology, that is tetatozoospermia, then reduced sperm motility, that is asthenozoospermia, and the autoimmunity and ejaculatory disorders and the idiopathic infertility. So the definition is the fertility, the unprotected sex or 1 year not pregnant. The frequency is 1 out of 6 couples in the US. They are experimental done. The responsibility is 35% female infertility, 35% male, 20% both, and 10% unknown. The maternal age for USA 20 to 24, 4.1%, 25 to recording 25 to 29%, 5.5%, 30 to 34, 9.4%, 35 to 39, 19.7%, and the 85% aided successfully increase the 90 to 70 now. So these causes of the infertility unexplained, it is about 18%, the male and female. The ovulation disorders, the tubuterous blockage, cervix, endometriosis, others, the sperm count and it defects, erectile or ejaculatory deficiency. It is more about the female infertility, ovulatory failure, polycystic ovarian syndrome, high androgen estrogen levels, resistant ovarian syndrome, gonadal dysgenesis, impaired gamete zygote transport, pelvic inflammatory disease, endometriosis, implantation defects, the progesterone, spontaneous abortions, the chromosomes abnormality. The male fertility is about, it is a cryptorchidism. So this cryptorchidism is sometimes the male baby may be born with undescended tests, and the failure of the testes to make their normal descent leads to cryptorchidism, and this condition is corrected surgical during early childhood, as it can cause sterility and is associated with an increased risk of testicular cancer. Then the chromosomes disorder, gonadal dysgenesis, obstructions, gonadotrophin deficiency, and this results in the low sperm count. Sperm is a very poor inequality. The female infertility test is for the ovulation, basal body temperature, ovulation kit, LH surge, other hormones tests, steroids, the post ovulatory block, laparoscopic fiber optic loop, hysterosalpingogram, postcoital cervical mucus and sperm antibodies, endometrial biopsy. So the laparoscopy is can find additions, structural abnormalities, and etc. The hysterosalpingograms, the male infertility test, sperm count motility greater than 20% or 20 million sperm per ml, and the check motility morphology is about greater than 50% and greater than 30% motile and structurally normal respectively. The older low take treatment is drug treatment for ovulation block, intrauterine inseminations and tubal surgery, high-tech assisted reproduction of technology, that is in vitro fertilization, and then the gift, that is gamete intrafallopian tube transfer, the zygote intrafallopian tube transfer, intracytoplasmic sperm injection, and etc. You can see this assisted reproductive technology. It is estimated about 1 by 100 births now, around 40,000 per year, cost between 7,000 to 15,000 per attempt. In the in vitro fertilization embryo transfers, they require for their male and female infertility. And the basic steps in the in vitro fertilization: ovary stimulations, and then egg retrieval, the sperm retrieval, wash sperm, fertilization, embryo transfer, progesterone, etc. And it is started with more than one egg. The drugs used for ovary stimulation. And why this transfer more than one in embryo? It is increase the pregnancy rate, leads to increased risk of multiple pregnancies in future. The test embryos before transfer. So the additional twist is that they needs to have a surrogacy. Surrogacy means the wound of this embryo from the others, and this needs to have the rent of the womb, and it is an option when women cannot bear a child, for example through a lack of a uterus. In such cases, women are enlisted and paid to give birth to a child. A contractual agreement is reached with the woman called the surrogate or the surrogate mother to have the baby using sperm from the male partner, and the egg may be supplied by the tactile infertile woman. And if she can produce good quality of the egg, then only this surrogacy cannot be done. Then egg donor plus the gestational period, egg donor plus sperm donor plus gestational, and frozen embryo, egg donor, frozen eggs, and cloning. So this is about this surrogacy. सो जर समजा मेल अँड फिमेल्समध्ये इन्फर्टिलिटी असेल तर त्याला पर्याय एक असतो, त्याचं ट्रीटमेंट घेणे. ट्रीटमेंट घेऊनसुद्धा हे होत नसेल तर मग सरोगसी करणे. तर अशा प्रकारे जर आपण केलं तर हे चांगल्या प्रकारे प्रेग्नन्सी होऊ शकते, अदरवाईज हे होणार नाही.